75 days after hair transplant, and hairs have fallen out. What happens now? Now it is 75 days after hair transplant, but hairs have fallen out. What happens now? I asked my doctor and he said this is normal, that it will regrow. Can I use hair oil for the head?
Thank you for your question. You've submitted a single photo showing a part of your scalp, and you state that you had a hair transplant about 75 days ago, and that you have had an episode where hair has fallen out. And you've spoken to your doctor who says this is normal, and so you're looking for some confirmation about that. And you also go on to ask, is it okay to place oils on your scalp? Well, I can certainly assist you with understanding what you're going through. A little bit of background. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Hair transplant has been a significant part of my practice, but more importantly, I'm the founder of Tricostem Hair Regeneration Centers. It is a solution we developed in our practice that's a non-surgical solution for male and female pattern hair loss using regenerative technology. And in fact, this evolved from the application with hair transplant. So I come with a lot of experience in this area. So to begin with, it's very important that you listen to your doctor and follow your doctor's guidance. An experienced hair transplant surgeon should be able to coach you through these processes. But it's very important to understand a little bit of what the concepts are that are relevant and important to hair transplant surgery and what can be a strategy for you moving forward. It was clear that you needed hair transplant surgery, and so because you probably lost so much hair that there was no other option but to do a transplant. Now, when hair transplant surgery is done, sites are made, and when you say sites, it's basically little small incisions in the scalp. So let's say you had 1,500 grafts, you had 1,500 incisions. Now, when the hairs are transplanted, there are two issues that occur. One is the transplanted hair goes into what's called a shock phase, where it'll grow for a little bit and then shed out, which is probably a significant part of what you're experiencing. At the same time, existing hairs that were thinning or may have been present that were not transplanted can also go into a shock phase and shed out. And that process is basically the hair follicle going into a phase called telogen. Telogen is the resting phase of a hair growth cycle. When hair is thinning, the active growing phase called anagen gets shorter, and the resting phase, telogen, gets longer. So time is what matters here. Now, in our practice, we have a lot of patients who have similar situations like yours, where they've gotten a hair transplant done elsewhere, and then they learn about hair regeneration. And I'll explain to you how this is relevant. Hair regeneration was first developed when we were doing a good number of hair transplants per week, and we wanted to achieve a certain amount of improvement or maximize the amount of yield of the grafts, because there's a certain percentage of grafts that don't make it, no matter who does the transplants or how it's done, and to improve the healing of the donor scar. And so we're using this material called acellular matrix. And what was observed periodically was that thinning hair became thicker. Now, what we learned from this is that we were able to improve the rate of growth or regrowth of the hairs that were transplanted. We were also able to somewhat mitigate some of the shock loss. But the challenge was, how much yield were we actually getting when you balance out the number of grafts placed, and not just the hairs that were shocked out, but also some of the hairs that were native to the area that were traumatized by the act of surgery. So as time went on, we developed a method so that with an injection alone, we're able to stimulate hair growth in a way that is really remarkable. We're able to stop progression. We're able to reactivate hairs that are not growing. We're able to induce the shed of thinning hairs with the subsequent regrowth of thicker hairs. Now, for people who have had hair transplant, they become very, very much aware about the potential and benefit. So a lot of people after hair transplant will find us, and ideally within the first 3 months of having the transplant, they get the benefit of expedited regrowth of their grafts, which we've observed consistently, as well as improvement of the existing thinning hairs. So now those thinning hairs will grow in thicker, and the grafts will grow in, and the aggregate benefit becomes significant. So also thinking through where is the future beyond this transplant, there is potentially an opportunity to maximize the value and benefit of your transplant by doing something proactive in addition to the transplant itself. So there's an opportunity to at least learn more, and of course this is something you have to consider the next time you're thinking of doing a transplant after you get past the 15 months or so that this process takes. But in the future, and something we've seen a lot, is people who've had a transplant who were satisfied with their results but are starting to notice a little bit of thinning. Instead of getting a second transplant, they choose having hair regeneration. So this is an important understanding, because for years we wanted people to try to stabilize their hair loss with finasteride. But finasteride for men is limited to about 60% of men. 40% it doesn't work. So, and in the 60%, a lot of people stop taking it for a variety of reasons. Currently, a lot of people are just not taking it because of fear of long-term sexual side effects. So asking this question opens the door to further education beyond just how to deal with the process of shock that you're going through right now with your hair. As far as oils are concerned, we have a lot of patients who come from India and who are of Indian background. It's remarkable, and people from all over the world come to our practice for hair regeneration, and I've been made very well aware of the beliefs about oils. Medically speaking, there does not appear to be any kind of therapeutic benefit to the topical application of oils relevant to hair growth. There could be some benefit for drier hair. I'm not going to debate that, but as far as the topical application of oils, people really have a strong belief in this culturally, depending on your family and where you're from. So as far as the safety of doing it, this is something that's probably not likely to be problematic, except it could block some pores and maybe cause inflammation or pimples. So just think that through before you start applying oils as well. So I hope that was helpful. I wish you the best of luck, and thank you for your question.